The real topic I want to talk about here is Joey Savacci, the Quad Lock Honda team. He's had an unbelievable season. Was fourth just a few weeks ago. Was fighting around the top 5 in points, and now goes down with a wrist injury. It's a dislocated wrist, and as soon as JT and I hear that, we're like, uh-oh. We've been around enough to know for some reason the dislocated wrist is worse than dislocating other things. So beyond Joey specifically, why is the dislocated wrist more complicated than a dislocated shoulder, for example?
Yeah, so dislocated wrist is a tough one. So if you look at the shoulder, there's big muscles around the shoulder. It's a larger area to distribute the forces and stabilize the joint. So oftentimes you can have a shoulder dislocation and even get back to riding within a week. The wrist is a completely different story. If you look at your wrist, there's no muscles across the wrist joint. It's all tendons and ligaments. Those structures don't have the same capability of protecting that joint once you have a dislocation. So when you have a dislocation, at the bare minimum, those ligaments are going to be strained or partially torn. Worst case scenario, there can be fractures, there can be completely torn ligaments, there can be bones that are dislocated. So there's a wide range of problems that can happen with a wrist dislocation. And recovery, best case scenario, you're talking weeks. Worst case scenario, surgery and months of recovery time.
So I've had this injury, not very much fun for those wondering, but I dislocated the lunate bone, right? On top of the hand and wrist there. And from my understanding, and clearly I'm not a medical professional, but it basically was you dislocate that bone, you need ligaments reattached, which then is you have to have a procedure done, and that's a lengthy amount of time. But you're saying there might be a chance that they could just be strained, and maybe he's talking about racing the first 4 pro motocross rounds. So there's a chance that they would not be torn, and he could still be available maybe earlier than we think.
Yeah, slight chance on that. If you have a true dislocation, then that means the structure was pushed out of its normal location. If the ligament was hanging on, didn't completely tear, that would be the best case scenario. But you're absolutely right, JT. A lot of times it's a complete tear of those ligaments. The only way to stabilize the structure, such as the wrist, is going to be surgery to help reattach those ligaments. The wrist is a critical structure, obviously, for racing. There's a lot of force on it, and it's in all different orientations and positions on the handlebars, depending on where you're at on the track. So you want to make sure that that wrist is stable and you have full confidence in it. So yeah, unfortunately, a lot of times, even if there's no broken bones, ultimately surgery is required to reattach ligaments.
Last thing, most weeks we have you on here, you talk about some of the new technology that allows you to either avoid surgery, like the patient that came to your office, who we will not name again, but also recover more quickly. So as bad as this usually is, are there things that allow them to speed up the process a lot from what it used to be?
Yeah, so let's just say surgery is required in this situation. Even after surgery, the cell therapies and the biologics we're using are accelerating those recovery times. So instead of depending on anti-inflammatories to just reduce inflammation and decrease pain, we're looking at active treatment, even in recovery, to help heal things quicker. We're seeing amazing results with the club riders we've been treating. Injuries that would take months to recover from, we're seeing in weeks now, and they didn't even have surgery. So, some of these surgical cases can be accelerated as far as returning to the track. And, if Joey's lucky in this situation and doesn't need surgery, cell therapy would be an excellent option to help heal those tissues, tighten up those ligaments, and make sure that everything's stable when he does get back out on the bike and track.
Well, we hope he does, because it's been a great season, and you hate to see it end on a sour note. He has been one of the best stories of the year. Unfortunately, just overshadowed with how good the championship fight is. So I hope he's good and quickly. Thanks for the info, Dr. Joe.
Thank you.